Hello again and welcome to my YouTube channel. Today I would like to talk to you about anxiety disorders in children and teenagers. I'm Tracey Maxfield, nurse, author, peer specialist and a staunch stop bullying and mental health advocate and educator. So anxiety disorders, I think, are probably one of the most confusing and misunderstood disorders, especially in children and teenagers, because a lot of the signs and symptoms may present as part of developmental childhood experiences and of being a teenager. However, what we really need to understand is that it can be quite serious and quite debilitating and impact the child or the teenager significantly. So what we learned back in blogs 1 and 2 and the corresponding YouTube videos was that mental illness or disorder is caused by a disturbance in one of the 6 domains of the brain. And one of those domains is actually the signaling area. So whenever we are stressed or anxious, nervous, scared, fearful, the signaling domain in the brain is triggered and our fight, flight, fight response is activated as a way of alerting us to danger and allowing us to take action to protect ourselves. So our reactions such as fear and stress and anxiety, they in fact are normal, healthy mental responses to unexpected changes. Once that stress has passed, then the flight, fight, fight response basically deactivates, it goes to sleep until the next time. However, in many children and teenagers, this flight, fight, fight response remains on and the child becomes hypervigilant or hyper alert, consequently has an anxiety disorder. Now, anxiety is actually the most common of mental disorders affecting children, teenagers and adults. Approximately 15% of children and teenagers and 30% of adults have an anxiety disorder. There are a number of anxiety disorders. I will outline them very briefly, but the 3 I'm going to concentrate on today are the generalized anxiety disorder, social anxiety disorder, and panic disorder. Other types of anxiety disorders include separation anxiety disorder, post-traumatic disorder, obsessive compulsive disorder, and the phobias, especially agoraphobia. So an anxiety disorder appears to be caused by a combination of factors, not only psychological factors, but also family life issues and biological factors. And so we have to take into account when looking at a child, teenager, or an adult, their life experiences, what has it that's brought them to the point that they now have an anxiety disorder. So contributing factors appear to be child development issues, family history, traumatic life event, I think ACEs, adverse childhood events, other medical or psychiatric problems, and alcohol, medications, substances. It's not uncommon for an anxiety disorder to go hand in hand with another mental disorder, such as substance use disorder, depression, eating disorders, bipolar disorder, schizophrenia. And so that's very important to identify the differences, because if you have a child who already has depression, it's so easy for you to think that the symptoms are just merely because of the depression when in fact they've now developed an anxiety disorder. So generalized anxiety disorder is a mental disorder characterized by incessant worrying and undue stress related to everyday things, everything and anything. A key distinguishing factor in generalized anxiety disorder compared to the other disorders is that the anxiety is focused on internal triggers, such as a performance in school or in sports, and as a result you'll have a child that does practices to the extreme studying. Now, generalized anxiety disorder appears to be more common in girls than boys, But both of them, both boys and girls, children and teenagers with an anxiety disorder, will need constant validation and approval and reassurance from others, especially peers, but more significantly, adults in their life. Sadly, what generalized anxiety disorder does is that it in fact affects the child's daily routine and can severely impact not only their daily life and their quality of life, but also how they function at home, out in the community, and in school. What's interesting is that children and teenagers with ADHD appear to experience more generalized anxiety attacks or disorder compared to children and teenagers with other mental disorders. So the signs and symptoms of GAD, or generalized anxiety disorder, is a persistent, excessive, unrealistic worry about everyday things, an inability to relax, they're irritable, they can't sit still, are rigid, especially in their way of thinking. Sleeping problems, including possibly night terrors, difficulty concentrating, fatigue, nausea, headaches, stomach aches, muscle tension, startles easily. Remember, they're hypervigilant. They could also have their heart racing, clammy skin, shaky limbs, especially if they're faced with whatever's causing the anxiety and they have no way of dealing with it. Also remember that the brain and body is connected. There is a pathway. And so when the brain churns out all these inflammatory chemicals because the signaling domain is on hyper alert, this inflammation goes systemic, right? So it goes all around the body. So you're also going to have corresponding issues in the body, hence the stomach and the fatigue and the headache and the muscle pains. Now, for a diagnosis of general anxiety disorder, the anxiety must be present for a minimum of 6 months. It focuses on everyday things and it causes significant stress in the child or teenager, and one or more of the symptoms that I've just mentioned is there. Usually it's at least 5 of them. Now, treatment for generalized anxiety disorder usually comprises of medications and psychotherapy, and I think this is one of the few times, with the exception of like bipolar disorder and schizophrenia, where initially a child or teenager may begin on a dose of an anti-anxiety medication to help them get over that hurdle, because when they're in therapy they're going to have to deal with the anxiety-provoking things or situation, which can then exacerbate their anxiety, which could lead to a possible panic attack. So it's not uncommon that they go on a low-dose anti-anxiety medication, whether taken at specific times during the day or used as a PRN as needed. Cognitive behavioral therapy is found to be extremely helpful. Exposure therapy, along with anti-anxiety medications, what we are finding is generalized anxiety disorder responds very well to antidepressants, namely the SSRI, the selective serotonin receptor inhibitors. Mindfulness, we're thinking about yoga, breathing techniques, deep breathing, relaxation exercises. Other treatment is a holistic approach to health, so you're meeting your physical, emotional, psychological, social, spiritual needs. Also, treatment will comprise of teaching the child or teenager coping strategies of how to manage the attacks and when they're confronted with, an exam or a football game. And again, it's promoting the healthy lifestyle, right? So it's exercise, diet, etc. So social anxiety disorder, slightly different from generalized anxiety disorder, because the focus is not on perfectionism, but rather what others think of the child or teenager, resulting in a persistent fear of embarrassment, ridicule, or humiliation in social settings such as school or at a social event. children and teenagers with social anxiety disorder are absolutely terrified that they will humiliate themselves in front of their peers, friends, and family by saying or doing something inappropriate, silly, becoming embarrassed, stammering words, turning red, shaking, crying, even vomiting. In many instances, the disorder usually develops after a particularly stressful and embarrassing incident that occurred. So the signs and symptoms of a social anxiety disorder are excessive worrying before school or an event or a particular situation, excessive preparation for maybe a class presentation or exam, crying, tantrums, excessive clinging, or social withdrawal, and somatic complaints such as stomach pains, headache, nausea, body aches. Now, similarly to generalized anxiety disorder, for a diagnosis of social anxiety disorder, the symptoms must have been present for a minimum of 6 months, must be consistent in similar settings, so such as in peer settings, in community settings, social event, or in school, and obviously has one or more of the signs and symptoms that I just mentioned. Now, treatment of a social anxiety disorder is similar to generalized anxiety in that we look at medications. So again, maybe an anti-anxiety medication and a SSRI antidepressant. Cognitive behavioral therapy, extremely good. Again, go for the holistic lifestyle, the healthy lifestyle, coping strategies, and again, relaxation techniques, meditation, breathing exercises, music, yoga, kind of distraction form. Family counseling also helpful, because if it's excessive worrying and anxiety, going to the shopping mall or going to a party or going to church, then that's something that as a family you need to work with and address, because it is serious, it directly impacts the child, and you don't want them to feel any further embarrassment or fear because they feel bad enough and are scared. Now, panic disorder can usually arise because the child or teenager already has social anxiety disorder or generalized anxiety disorder. That's when it's gone to its extreme, and either treatment has not begun, or is not being followed through on appropriately, or is not being as effective as one would hope. And a panic disorder is characterized by panic attacks that last for approximately 20 minutes, at least once a week, and there is an episode of intense fear that is usually accompanied by the following symptoms: rapid breathing, difficulty breathing, sense of choking, pounding heart, chest pain. Lots of people say they feel like they're having a heart attack. Their chest is coming out of their body. Sweating, palpitations, feels numb, kind of detached, almost going crazy. Intense fear, trembling, flashbacks, especially flashbacks when you think PTSD, and feels faint. Now, panic disorder is more common in teenagers than young children, but what's important to note is that panic attacks can occur in any type of anxiety disorder, and it is usually in response to the focus of the disorder. So let's give you an example. Child has to go and give a speech in school, has to go to the front, social anxiety disorder related to that. Treatment is not really helpful. They work themselves up into such a state and become so fearful that their fright response goes into mega overdrive and triggers a panic attack. Panic attacks are extremely scary. You literally feel like you were going to die. Intervention is actually quite simple when you know what to do, but you can just imagine for a child, or mainly more for a teenager, because it does occur in them more often, it can be actually quite debilitating. Now, for a positive diagnosis of panic disorder, a child or teenager must experience spontaneous panic attacks, seemingly, quote, out of the blue, along with the physical, emotional, and cognitive symptoms that I already listed. It's interesting, my very first panic attack was when I was 13 years old. I went to the classroom, sat down for my English exam, and suddenly felt hot and clammy and sweaty, thought I was going to pass out, felt the room was closing in on me, developed tremendous chest pain, intense fear, and actually couldn't concentrate. I didn't leave the room, I just sat there almost inert until it finally passed. I was shaking like a leaf. Needless to say, I failed the English exam, which was quite unknown because I always aced English. And so again, that seemingly came out of nowhere. When we looked back, it was just the extreme pressure that I was going on, childhood abuse, very stressful in home at that time, and also the need to excel at this particular subject. And so that was my first panic attack. So panic disorder is usually treated again with a combination of medications and behavioral therapy, plus self-help strategies for managing the panic attack. So how do we manage a panic attack? Well, if they have PRN anti-anxiety medications and they're able to take it, that would be a good first recourse. But if medications are not available or not prescribed, first thing you do is you move them to a quiet, safe, private environment, usually kind of sitting down on the floor, and get them to deep breathe. And sometimes it helps if you actually give them a brown paper bag, breathe in and out, it just regulates their breathing. Recognize that it is a panic attack, that it will pass, it is nothing serious. Get them to close their eyes and practice mindfulness. Go to their happy place. Recite a mantra, a poem. Concentrate on music if some is being played. Close your eye, feel the sun on your face, you're on the beach, water lapping. Or focus on an object or an image. Practice muscle relaxation techniques, and if possible, use a cool compress on the neck and on the forehead. And a sidebar is, I have found that if you get somebody who's having a panic attack to hold on to something very cold, like an ice cube or a pack of frozen peas, or run their hands under ice cold water, that will actually get them to calm down and regulate, because their focus turns from the panic attack to the actual cold water on their fingers. So that is found to be very, very helpful. Tips for parents, and I think anyone, friends, family members, siblings, teachers. What we know is early intervention and treatment for an anxiety disorder can not only help a child or teenager understand and manage his or her feelings and responses, but can help prevent further complications, such as getting into a full-blown panic disorder, panic attack. Also, it's not uncommon for children, especially teenagers with anxiety disorder, to turn to substances and alcohol to help them when they feel nervous, and that again can lead to additional problems. So some suggestions to help your child or teenager manage his or her anxiety disorder include, I think the first thing is stay calm. Above all else, stay calm, because if you get fretful and panic, that's only going to make them worse. Be understanding, supportive, show love. I always talk about that. Accompany them to therapy, follow through with the therapy, administer medications, follow up on appointments. Recognize and praise the small accomplishments. If they start going backwards, or if they have anxiety, you don't humiliate, ridicule, threaten, or intimidate them. Pay attention to their thoughts and feelings, their fears and concerns. Listen and talk to them about it. Maybe get them to express what they're feeling, their anxiety, in poetry or in art, in writing, like journaling or music. Give them an outlet to help you understand. Never invalidate their feelings. Maintain their daily routine as best as possible, but obviously follow up with the school and to help give them strategies to help should an episode happened there. And then promote a healthy lifestyle. I can't stress enough, fluids, water intake, a healthy diet, exercise, meeting their social, spiritual, physical, emotional needs. And I think the most important thing is patience. Once the child or teenager understands what is going on, and with therapy, cognitive behavioral therapy especially, they learn how to develop coping strategies so they can reduce the intensity of the anxiety attack, or manage the panic attack. It empowers them, gives them a sense of control, and so the next time the situation arises, they're better equipped because they can start employing their pre-learned coping strategies, and then when it's less of a reaction, they feel better, and then the next time it's even less, and before you know it, they may still feel nervous. That's feeling nervous before something is normal, but they don't have the full-blown A, panic attack, or B, go into this constant generalized anxiety or social anxiety disorder. So I hope you found that information helpful. Next time, the YouTube video blog post is actually going to be on the week of Christmas, Kwanzaa, and Hanukkah, and it will be a discussion more around mental health tips to survive the holidays. I hope you'll join me then.